Until a year ago, this path was more like a sewage-filled swamp. And this, a once defunct village health sub-center, now not only has a doctor on staff, but is also being upgraded to a primary health center with beds. This is the story of a health policy and systems research project that took place in 50 villages in North India. It was designed to implement and study the implementation of the guidelines on village health committees laid down in the National Health Mission.
We knew that even though we were using government-led policy guidelines and training handbooks, whatever we did should mirror the government system. So in terms of the design, in terms of recruitment of staff, in terms of training them using existing government guidelines, we had to do it in a way that would be acceptable to the district level system as well as the state level system, and eventually it would become national. So we had to mirror exactly what the government would do if it were taking it to scale.
The partners who undertook the project together were the Public Health Foundation of India, the group that I am associated with. We also had an international university who partnered with us on the technical side. We worked very closely with the national government, the National Health Mission, and the state government of the state where we undertook the project. And we also worked closely with a local implementing NGO who actually undertook the intervention of strengthening the village health committees.
Health policy and systems research is a unique field that comprises of a large family of approaches. The question asked and the demands of the project determine the framework. This implementation research project focused on making an established program work better. Over the next year, the implementing NGO helped transform the village health committees into functional representative bodies accountable to the community. The committees, with their newfound understanding of their rights, duties, and powers, began to identify and prioritize the needs of their community.
चोरी अन्याय हम नहीं कर रहे, गलत चीज हम नहीं मांग रहे, गलत हम किसी का डाका हम नहीं डाल रहे, मांग तो हम सिर्फ पानी रहे हैं ना। तो VHC जिंदाबाद।
So as such, it was a government intervention that was put into place with the support of a local NGO, and that consisted of a strengthening package including training and community mobilization activities and the engagement of some facilitators and institution of new rules and guidelines for village health committees.
Issue after issue is raised in the village committee meetings and addressed using the powers vested in the committee.
ग्राम स्वास्थ्य समितियों के गठन के बाद में उनको प्रशिक्षण किए, फिर दोबारा से हमने फॉलोअप प्रशिक्षण किए, तो लोग जागरूक हुए, धीरे धीरे जुड़े, और जब उनको रिजल्ट आने शुरू हुए तो वो प्रशासन के साथ भी अपनी बात को रखने लगे.
Researchers studied the process of strengthening the committees using a range of qualitative and quantitative methods.
So what we found was that the most successful strategies and innovations that were put into place by the implementers included such strategies as hiring locally, making sure that facilitators were sourced from that region, making sure that teams of workers work together and workers were not working in isolation, and also the importance of continuous support for the implementing agency.
I think there are a few key lessons that we got from here. The big thing is sensitization of service providers that we learned to the whole process of community participation. I think is an important learning from this project that policymakers and programmers, particularly at the district and sub-district levels, have to learn.
देखिए, सबसे पहले तो हमारी सबसे खुशी तो ये है कि हमारी हॉस्पिटल चालू हुई है. जो हमें सबसे खुशी तो इससे मिली है कि हमें बार-बार कहीं बाहर नहीं जाना पड़े, हम बच्चों को लेकर
Health policy and systems research can help answer complex real-life questions that policymakers have. This study showed how village health committees can be made to work better. The lessons learned will be used to improve the national guidelines for village health committees and to scale up village health committees across the country.